You voted for our next career battle, and your choice was clear: psychiatrist versus psychologist. Dr. Jubal, MedSchoolInsiders.com. Welcome to our career battle series, where we compare two different medical career options to help you decide which is the best path for you. We'll break down compensation, lifestyle, length of training, and the pros and cons of pursuing each career path. In previous videos, we covered doctors versus surgeons, diagnostic versus interventional radiologists, and neurologists versus psychiatrists. Today, in the battle arena, we have psychiatry versus psychology. Both careers focus on studying the mind, emotions, and behavior, and treating mental disorders. Let's get straight to the point. The main difference is that psychiatrists are medical doctors, while psychologists are not. This means only psychiatrists can prescribe medications. Psychiatry is a medical specialty, meaning its educational background and approach are rooted in the biomedical model. The training focuses on complex diagnosis, including navigating co-occurring medical diseases like thyroid disorders and neurological conditions, and managing both psychiatric and other types of medications. They often order diagnostic testing to rule in or rule out both medical and psychological conditions. Psychiatrists are trained in multiple modalities of therapy, including CBT, DBT, motivational and supportive therapies, and psychodynamic and psychoanalytical approaches. Psychologists, on the other hand, typically focus on the psychological aspects of a patient's wellness, including diagnosis and psychotherapy. Their background is rooted in social sciences research, although there are pathways that emphasize clinical work as well. Whereas psychiatrists are either MD or DO physicians, the two major degrees for psychology are either a PhD, which emphasizes research, or a PsyD, which emphasizes clinical practice. They can also perform neuropsychological testing to help understand the ways in which patients process information. Despite the differences, there is a great deal of overlap between these two career paths. There are psychiatrists who only practice psychotherapy, for example, and health psychologists who are embedded within robust medical teams in hospital settings. Certain subspecialties, like neuropsychology, integrate these approaches even further. So how is training different between psychiatry and psychology? Psychiatry is a medical specialty, which means psychiatrists follow the typical route of becoming a medical doctor. 4 years of undergraduate studies with pre-medical coursework in any major, often biology or psychology, 4 years of medical school, and 4 years of residency. Additionally, psychiatrists can further subspecialize with a 1 to 2 year fellowship in a variety of areas, including child and adolescent psychiatry, forensic psychiatry, and addiction medicine. These subspecialties and many more are covered in our psychiatry career paths video linked in the description. Depending on your goals, the total educational timeline for psychiatry is 13 to 14 years. While the total cost of training is difficult to estimate, the American Medical Association reports the cost to be around $160,000 for in-state programs and $260,000 for out-of-state and private school options. In addition, the average cost of a 4-year undergraduate degree is approximately $110,000 at a public university for in-state students and over $160,000 at private institutions. This brings the total educational cost to roughly $270,000 to $420,000 before accounting for interest and living expenses. Clinical psychology follows the social sciences rather than medicine. After completing a 4-year undergraduate degree, often in psychology or a related field, aspiring clinical psychologists typically pursue either a PhD or a PsyD, which takes around 5 to 7 years to complete. The pathway includes extensive coursework, research or dissertation work, and supervised clinical training. Following graduation, psychologists must complete a 1-year postdoctoral fellowship or supervised practice, bringing the total timeline to 10 to 12 years, only slightly less than their medical counterparts. The specialization options for psychology include clinical child psychology, neuropsychology, health psychology, forensic psychology, and others, often through postdoctoral training or board certification. The total cost of psychology education can vary even more from that of medical school. For example, there are PhD programs that heavily subsidize the cost of attendance in exchange for teaching or doing research, and there are private PsyD options that are comparable or can even exceed medical school tuition prices. Next, how does the compensation compare? Overall, psychiatrists are paid more than psychologists in the US due to higher health insurance reimbursement, more concierge and direct pay options, and easier integration within medical systems. Currently, psychiatrists earn around $330,000 on average. The US Bureau of Labor Statistics and the American Psychological Association report average salaries of psychologists at around $100,000. Both professions can vary significantly depending on the compensation source, practice structure, and even geographical location. In general, the Northeast and private practices tend to command higher salaries for both fields, while public sector and nonprofit roles pay the least. When it comes to compensation, psychiatry is the clear winner. The average psychiatrist earns 230% more than the average psychologist. But keep in mind that this higher paycheck comes with a higher cost of education. The average physician leaves medical school with over $260,000 in debt. Now, what are the lifestyles like? Both offer flexibility, especially with the rise of telehealth, and both have many part-time and full-time options. The typical schedule for most psychiatrists and psychologists is 40 hours a week with limited to no call. That said, many psychiatric hospitals and medical settings do require 24-hour psychiatry staffing, either remotely or on-site, which provides lucrative moonlighting options. Additionally, due to the medical education pathway for psychiatry, call is typically required during medical school and residency. When it comes to lifestyle, psychology has an overall advantage. Let's talk the pros and cons of becoming a psychiatrist. First, the pros. Expertise. As a medical doctor, psychiatrists are considered the expert in managing mental health conditions. Second, leadership. Psychiatrists are often considered the leaders of behavioral health teams, serving in roles such as attending doctor, medical director, and consultant to other physicians. And third, compensation. Due to this advanced skill set, reimbursement remains high for this specialty, especially considering the reasonable work-life balance that comes with it. Now, the cons of becoming a psychiatrist. First, rigor. The academic pathway to becoming a medical doctor is notoriously intense, with intense competition as a college pre-med, highly rigorous years in medical school, preparing for board exams and conducting rotations in various specialties, and a more reasonable residency that will still require occasional call. Second, burnout. While rates of burnout are typically lower than in other specialties in medicine, the emotional intensity and administrative burden make it generally more prone to burnout compared to psychology. And third, caseload difficulty. Many psychiatric patients are complex with chronic medical and severe mental health conditions, which can be challenging to manage in a fragmented healthcare system. Now, let's consider the pros and cons of becoming a psychologist. First, the pros. Lifestyle. Psychology is the true winner when it comes to lifestyle, both during training and when working in the field. Second, autonomy. Psychologists, especially those in private practice, often have more time with their patients and more freedom to focus on psychotherapy without being pulled in different directions. And third, deeper emphasis on behavioral science. Psychologists receive more rigorous training in psychological testing, developmental theory, and evidence-based therapy modalities. Now, the cons. First, lower earning potential. On average, psychologists earn significantly less than psychiatrists, even in private practice models. Second, less structured pathway to independence. Psychology training can seem fragmented and inconsistent compared to the medical model, which has more streamlined licensing requirements and regulated training programs. And third, limited prescriptive authority. Most psychologists cannot prescribe medication as they do not have the full breadth of training as a medical doctor. While some states do offer advanced training pathways for psychologists to gain limited prescribing rights, this remains controversial and is significantly restricted compared to psychiatry. So, which path is best for you? If you value medical training, want the authority to lead interdisciplinary teams, and prescribe medications with the flexibility to do psychotherapy, and are comfortable with high responsibility and complex patient presentations, psychiatry is the stronger option. It offers higher pay, broader clinical authority, and more versatility across settings from inpatient to medical consultant to private practice. The main trade-offs are intense training, a greater risk of burnout, and a health system that often reduces psychiatrists to medication managers unless you carve out a niche in therapy, lifestyle psychiatry, or mind-body medicine. If you're more interested in psychotherapy or psychological theory, or prefer a lifestyle with more autonomy and potentially less administrative overhead, psychology offers a better fit. The training background is more humanistically centered, with a deeper emphasis on psychotherapy, albeit with notably less pay and limited medical scope in general. The bottom line, psychiatry is often better suited for those with a strong scientific background, while the academic endurance and research demands of psychology are better suited to those with a strong social sciences background. Choose psychiatry if you want medical authority, higher pay, and flexibility, and are willing to tolerate a complicated healthcare system. Choose psychology if you want therapeutic depth, autonomy, and academic rigor, and are willing to tolerate a less lucrative path. What medical career paths would you like us to cover next? Doctor versus nurse practitioner, neurosurgeon versus neurologist, or EM doctor versus trauma surgeon? Let us know in the comments.